Hey everybody, Dr. Rob here. How are you today? We've got our Facebook Live podcast today. Some real interesting topics. As always, we've had the weekend to accrue more information. I hope everybody had a great weekend. I hope you all exercised, ate well. Where we were, Saturday was a beautiful day. Great day to go outside. Interesting updates on what's going on in our health and everything like that. The field is expanding for the information. And I'm excited to, like I said, to accrue the information to be able to share it with you. So I appreciate all the inboxes, all the questions, all the information. But just so you know, I'm getting all the information I can on the antibody tests. I'm trying to share it with everybody. I'm trying to share all the information in reference to what's going on with the COVID-19 and, your overall health. One overriding theme, every time I have a conversation with my colleagues, it's very evident that this is a virulent virus. We need to be careful of it. Very clear. Number two, it's not like a typical flu. It seems to be much more potent than a typical flu, and it really seems to grab the lungs. Number three, I hope everybody's able to get a test, because the more testing we have, the more we're going to be able to understand where we are, how to go forward, how to reopen the country, how we can start seeing new patients, which I'm getting to the point, doing a lot of telehealth where I'm going to go back in. I've got all my personal stuff, all my gear and everything for my staff. And as we all know, different parts of the country are affected differently. Having said that, a lot of this new information that came in over the weekend is something that's exciting. It's interesting. And again, we're expanding the list. So let's take a look at some of these these 6 new symptoms, if you will. So the symptomology is growing as the comorbidities. The point I wanted to make about the comorbidities was very simple. Many of these comorbidities are due to lifestyle. And then we talked one, lifestyle. 2, more so than lifestyle, we talked about obesity. Now, obviously, obesity for the most part is a lifestyle issue. And more so than obesity, really getting to the root or the root cause, it's gut and your overall gut health. We talked about gut to lung. We talked about gut to hypertension. We really showed you over the last few weeks how gut can lead you down a path of obesity, prediabetes, damaged gut, leaky gut, not a gut that's in a pristine condition. In addition, gut to lung, we talked about gut to brain. So a lot of these comorbidities and lifestyles are obesity going into the gut. My mom called me yesterday and she said she was watching TV. What percentage of Americans are obese? 42.9%, Mom. She said, what about overweight? Well, I always say 75. It's 73 to 75% are either overweight or obese. So that's 3/4. She goes, I can't believe that the country got so heavy. My mom doesn't get out. She doesn't really walk that well, stuff like that. However, the country is heavy, and it's a lot about what we do and a lot about our lifestyles. So as we get into these 6 symptoms, feel free to give a shout out. We'll answer questions after the symptoms, and then we're going to go on to another topic. Let me know where you are. Let me know how you're doing. So with that already being covered, let's look at the 6 new possible symptoms. Number 1, chills. So if you have chills, that can be a symptom of COVID-19. Repeated shaking with chills, almost to the point where some people have told me who had it bad where their teeth are chattering. Muscle pain. Now, muscle pain makes a lot of sense, muscle ache, myalgia. And the reason is that we all have heard about the NLRP3 inflammasome. That inflammatory pathway is the one that stimulates NF-kappa B, that releases these interleukins, which lead you down a path of a cytokine storm. Now, what you'll also notice if you were to look at any of the pathways, it also damages the mitochondria, the powerhouse of the cell, and increases ROS, which is reactive oxygen species. All of that will lead you down a path of myalgia, muscle pain, and fatigue. So that's not uncommon. Headache. Well, I think the headache is interesting in that the headache's probably very associated with the fever, and we know the fever is probably the number 1 symptom that everybody has because you're raising your temperature to try and kill a foreign pathogen. You're making in yourself an inhospitable host. Sore throat. Several people have called me and said, I know somebody was exposed in my house and I'm getting a sore throat. That's a beeping red light that something may be going on. And the big one now, the loss of taste or smell. About a third of the people lose their taste of smell and taste and smell. And it takes like 2 to 4 weeks to get that back. The average is about 3 weeks. Losing your sense of smell is typically not uncommon, but there's no runny nose with COVID-19 for the most part. So it really shows that the cranial nerves are damaged. It shows that the central nervous system may be implicated. And this is not your typical flu. This is a lot, as I said before, more virulent. Now, the reason for this expanded CDC list is, and it is extremely significant, is most testing sites require a patient to have COVID-19 symptom before the individual can be tested. So if you have one of those symptoms or you adhere to the new length of symptoms, you may be able to get the PCR swab. That swab is important because it tells you yes or no. I just was asked on Facebook before I came on, and I can answer it now. Somebody said, I took your antibody test. I took it a week ago. They were negative for IgM and IgG. But now I have a sore throat because someone in the family was exposed to someone who was positive. Do I take the antibody test again? You could. Or what's the difference between that and the PCR swab? Well, the swab tells you yay or nay, yes or no. The antibody tells you the direction and the time frame in which you are there. You can be PCR negative because you're going out of it, yet IgG positive. So there's a lot of variables. I suggested to him, since they test for different things and antibodies are the big thing because they're your own body's protection, to go get the PCR test. So any questions on the symptomology or anything, you let me know. I'm going to move on to the impact. This is really interesting. I wanted this to be the headline, and I wanted this to be the headline for everybody, but the symptoms seem to catch, when we put it out to a few people, catch their attention. So the impact of nutrition. This was an article in Brain, Behavior, and Immunity, April 18th, 2020. The title of it was The Impact of Nutrition on COVID-19 Susceptibility and Long-Term Consequences. So it's very interesting. Yep.
Beth said, I had all these symptoms but never a fever. Cough went through both dry and wet. There's no defining boundary for this. Good news is I survived, treated at home. Immunocompromised and high risk, but naturopathically sound advice brought me through this.
Great. Beth, I heard the whole question. You know, she went through the whole thing. Naturopathic advice helped her through it. She had a whole list of certain symptoms. You don't have to have them all. It's not a true checklist. It's a checklist. Took her 7 weeks. My suggestion is, let us know. I think you should take the antibody test so you know if you have the IgGs. That would be great. That would be my suggestion to you. I'm very happy to hear that you got through it. I understand you're immunocompromised, and that is a huge symptom. That is a huge comorbidity. And that also can be attributed to gut health.
Mike Powell, PCR negative but IgG positive is the goal?
PCR negative and IgG positive and IgM negative, PCR negative, IgG positive would be a great goal. I know that sounds horrific. And of course, never to feel sick. That would be the ultimate goal. That's what everybody's hoping for. I had it, I didn't feel bad, it leaves no damage. A couple of very close members, friends of ours, are now really showing all the signs. They went to urgent care. They've got it, the fever, the cough, they've got it. There's no doubt about it. They've hit the symptomology. 2 out of the 4 of them have pneumonia. Now, not that many flus. I know that people have pneumonia. This is something that I'm seeing very common. Another symptom of having it, I believe they should include pneumonia. I'm just checking with you. We're good? All right, great. So getting back to the impact of nutrition on COVID-19 susceptibility and long-term consequences. So interesting. They talked about a high rate of diets. Those people that were eating a lot of saturated fats, a lot of sugar, and a lot of refined carbs. So saturated fats, not that saturated fat is that bad, but a lot of saturated fat, sugar, refined carbs, they classify this as the Western diet, or I like to call it SAD, the standard American diet. So in that type of diet leads people to have a higher incidence of obesity and type 2 diabetes. And those two go together, obesity and type 2 diabetes. They have both prodigiously increased in a parallel form, and we now call them diabetes. And most of that came since the 1970s, when the US government very simply said, we don't want any heart attacks. We want to decrease the number one killer at the time, heart attacks. How can we do it? They asked all the cardiologists, and at the time, in their infinite wisdom, they said, no fat, just carbs, which obviously in retrospect looks pretty bad. In addition to that, not taking any disparaging positions against anybody. In addition to that, then we really started to make a lot of refined carbs and fake carbs and everything like that. And where did that come from? One article in 1965 from Harvard University by 3 researchers. This is documented, just came out a couple of years ago. Those researchers are now not here on the earth, and they were paid in today's term $50,000 to, amongst the 3 of them, today's dollars, to say that sugar was good and fat was bad. Fat is not your foe, it's your friend if you use the right kind of fat. So having covered that, no surprise that obesity and type 2 diabetes, both of which is probably the overconsumption of crappy carbs. Okay, great. So the standard American diet or Western diet consumption activates your innate immune system and impairs your adaptive immune system. So think about this. We have those 2 immune systems. We have our barriers that we talked about, our skin and our gut, and then we have this beautiful immune system. It's innate, which God gave us, as we always talked about, versus acquired and adapted. So innate and acquired, we need them both. So interestingly enough, the innate goes on fire, it elevates too high. That doesn't work. If it's decreased, that doesn't work. But it's up and the acquired goes down. So now you have an immune system in override and you don't have its backup there. That poses a problem, all because of what you eat. Food is information for your body. Bad food leads to inflammation. When people say, my diet's pretty good, it doesn't really matter that much, it's wrong. It matters. And here it is. Here is your watershed moment. Food affects your immune system. So too many carbs, too many sugars, too many crappy fats, not all fat, fat is typically your friend, increases your innate immune system, which is aberrant, and decreases your acquired, so you have no backup plan. Let's go through it. What does that lead to? Number 1, chronic inflammation. Number 2, in today's terms, impaired host, us, defense versus viruses. So it leading you to too much inflammation. So obviously a cytokine storm is easy, and impairing your own defense mechanisms, which is the bulk you need, this adaptive acquired, to kill the viruses, because in the adapted and acquired are your immunoglobulins and antibodies. So maybe if we can make, it is conjecture, maybe some of those people who said, I think I had it, I'm really surprised I don't have antibodies, maybe they didn't get the antibodies, we're not sure. Conjecture once again, they didn't get these antibodies because their adaptive immune system was decreased so very much. In addition, within the elevation of saturated fats, you can lead to chronic activation once again of the innate immune system and inhibition, not just a decrease, of your adaptive. So saturated fats or excessive saturated fats induce a lipotoxic state, activating the innate immune system, and I'll make sense of this, via toll-like receptors seen in macrophages, dendrite cells, and neutrophils. Toll-like receptors, they're receptors on cells that depict whether you're going to produce inflammation. Many of them speak to what we said, the macrophage, the captain of the ship of inflammation. They are these inflammatory guys running around, and they release neutrophils and leukocytes at the acute state. Dendrite cells in your gut, what I call the periscope of the gut, to determine, are we going to use an innate immune or are you going to use adaptive immune? So toll-like receptor also communicates with something that we talked about before, your vagus nerve. So here we have the immune system and the nervous system again being matched, intertwined, because the body's all interconnected. It all communicates with each other. My mom, who is not a doctor, once said the body is like an engine. If one thing's broken in the engine, it's going to put a strain and break the other things. And she never said anything more poignant than that. What a huge takeaway in a very easily accessible concept. In addition, increasing the Western diet or standard American diet, and including those, again, the carbohydrates, the sugar, and the saturated fat, inhibits T and B cells. So T cells come from your thymus, they're immune. B cells come from your bone, those were immunoglobulins. It also has shown to allow for B cell apoptosis, that's cell death. Your B cells die. Your immunoglobulins, your antibodies, what you need, your natural protective cascade isn't turning on because you're eating too much sugar and eating too many carbohydrates, leading to what they call B cell immunodepression. So your immune system isn't functioning. Nobody's saying that you're not going to get COVID-19. All they're doing is analyzing how to be the strongest, most inhospitable host. And this will not only work for now, this is something that we all want to do for life. What do they all say? Immunocompromise. All these comorbidities. You're really looking at letting your system function to aid yourself in its moment of need. By increasing your innate immune and decreasing your adaptive, you're leading to chronic inflammation and, again, impaired defense against viral pathogens. Most interesting, increased peripheral inflammation in COVID-19 can also lead to a neurodegenerative disease. So, wow, so you're inflamed, your body's inflamed because of COVID-19. That inflammation goes through your body. It's not just in your lungs. Remember, it's also in your gut because you're doing viral shedding. Your gut communicates to your brain. Your blood system communicates with your brain. You have an increased incidence of neurodegenerative disease. And we know that it damages the central nervous system because you lose your sense of smell and taste. In addition, this is complicated by an unhealthy diet. Food is inflammation if it's poor. Food is information if it's good. Now, the conclusion in the article, it had two conclusions. I'm going to read them to you. Number one, critical to consider the impact of lifestyle habits in susceptibility to COVID-19 and its recovery. Lifestyle habits. So if you're calling me up, many people, hey, do I have the antibodies? Yes, no. Okay, thanks. Where are you going? I mean, like, where are you going? Really? I mean, the New York actually comes out of me. Where are you going? OMG, all these other things. Now's your time to say, okay, I have the antibodies. Great. Good. What do I do to ensure that I'm going to have immunosupport and I can always have immunorejuvenation? You got to do something now. You got to always adhere to a good diet and take some needed supplements. Now, if you don't have it like I do, I'm doing everything I can because I know the intruder is coming. He's out there. And I'm not trying to scare everybody because I'm going to go back to the office. I'm going to see patients. I'm going to get on a plane in June. I'm going to get in a room and start lecturing to people all the things that are probably not quarantine sane. Having said that, I need to keep myself in the best condition that I can. And you know, it's really funny. I think now, even for someone like me who's a little neurotic about all these things, I'm definitely even more spot on than before. And I can tell you, feel good. It's great. Quarantine wasn't as bad as you would think. And I strongly suggest adhering to good lifestyle habits. In addition, part number 2, it is the author's recommendation that individuals refrain from a poor diet and consume high amounts of nutrients to boost your immune system or immune function. Wow. It's all about lifestyle. It's all about diet. And they really were specific in this article to the foods that we eat. So I hope I've made a relatively compelling argument. If you have any questions, I'll answer them now because I have one more tie-in between diabetes and coronavirus. We're good? Excellent, excellent. I think I was pontificating. Everybody took some notes. So somebody had asked me about the diabetes, to put this aside, the diabetes and the coronavirus risk. So the coronavirus can enter the body. Some of the things that are new, and a huge takeaway, is the amount of the virus. So what am I saying? What are we starting to theorize, or what I'm seeing a lot of these doctors theorize? So if I come in contact with someone that has one strain and I brush against them, and it's not as virulent a strain, if you will, or it's not as populated, I'm probably not going to get as sick. So that's me one-on-one just rubbing against somebody.
This is my question. COVID-19 isn't just one strain?
No, there's multiple strains. of COVID-19, but I'm not infected. I'm infected by one person who doesn't have the really powerful strain. The second scenario is I go to New York City. I know the restaurants are closed, but they open. There's 100 people. We have a 2-hour dinner. 6 people have it, and I get brushed by 6 different people. So I get infected 6 different times. I get a bombardment. Obviously, I'm going to be under a different kind of viral pathogen strain. Also, the outcome is how much does the virus replicate? How strong is our immune system not to let it replicate? What kind of foods and supplements are we taking, not allowing it to attach to the ACE2 inhibitors? How much replication occurs on the lung? And one of the biggest things is the amount of cytokines that are utilized for the immune response. So if my innate immune system is good, and my adaptive immune system is good, and I'm not too inflamed before, I should have a better outcome than if I didn't have any one of those 3 aforementioned. Individuals with diabetes typically have a delayed immune response. And part of the reason they have a delayed immune response is 1, they're inflamed, and 2, sugar is extremely ruinous to overall health, and sugar ultimately, high sugar levels, insulin resistance, very inflammatory. So those who have prediabetes or high blood sugar or things of that nature are sitting in a position to get an adverse outcome if they were exposed to COVID-19. So I hope this has been informative for everybody. Remember, every day, 1 o'clock to 1:30, Monday through Friday. Feel free to ask questions. We always get a lot of questions. We get a lot of inboxes after. I am encouraging everybody to say hello. I'm encouraging to share. Please share this. Press share. We'd like to get more shares. We want to see people share in this information. We think it's very valuable. So I hope you've liked today's presentation, if you will. If there's something that you'd like to see tomorrow, please let me know in the comments section. If you have any questions like that young woman for the antibody test, I'm happy to share that with you. And so far, for these 4 or 5 weeks, it's been my pleasure. And I think we've covered a lot of terrain on all these Facebook Lives. So if you will, Dr. Rob, always yours in health.